Hey everyone, this is Troy again with Advanced Spine, Joint, and Wellness. Hey, if you tuned in last week, thanks for some of the comments. Thanks for listening and tuning in. We had a handful of patients come in this week with previous back surgeries who are seeing some success. So hey, if you're looking for us online, you can go to ohiopain.com and that'll take you directly to our website. If you're following us on Facebook, you can find us at Advanced Medina, and Instagram, Twitter, and YouTube. We put a lot of information out on YouTube. So, hey, this week we're going to talk about a fun topic. I touched on it last week during the post-operative podcast that we did. Now, today what we're talking about is SI joint problems. And the reason to talk about SI joint problems is, here's a big problem that we see is a lot of doctors, surgeons, pain management doctors, family doctors, oftentimes we look at a patient, we listen perhaps poorly, and then we look at some images. And we may look at x-rays, MRI scans, CT scans, something like that. But here's the problem we often see is that we're treating the image and we're treating an x-ray or an MRI, but we never really put hands on, and perhaps we've never really listened well to what the complaint is. And this is a common issue that we see. Oftentimes our exam here is extremely thorough, and patients oftentimes look at us funny and go, "Sheesh, that's the first time anybody's ever actually looked at me," which is concerning. But that being said, the point is, if we're only treating images, the only thing we're looking at is for problems within the spine and the spine itself. MRIs and x-rays do a great job looking at the spine. If we look close, we can see problems with these little joints that we're going to talk about today that are called SI joints. But it's a common complaint. It commonly gets misdiagnosed. It commonly gets overlooked because we are so spine focused as the source of the issue. So first, let's talk a little bit about symptoms with an SI joint and what an SI joint is. So let's start about a little bit with an anatomy lesson on what is an SI joint. So this is a spine. If someone were standing looking towards us, this is front, this is behind. So if we look from behind, the SI joint is made up of basically two bones. This tailbone right here is called the sacrum, so this bone here, and this large bone for the pelvis here is called the ilium. So this joint, or this union between the two, is called the SI joint. And it's a joint that is designed to be mobile. And oftentimes we see that it isn't, that it's very fixated or stuck. I like to use that Tin Man analogy, like the Tin Man. This joint can be very, very fixated. If that phone is ringing, sorry about that. We're just gonna drive on. There'll probably be a little noise while I'm talking through here. So with the SI joint, what we commonly see is we see pain, and oftentimes pain that patients will report, quote unquote, as hip pain. So oftentimes patients will go, "Oh, it's my hip. My hip's bothering me." And they'll point to kind of the back of the glute area is where we commonly see pain located with this joint. And oftentimes the joint is either just fixated or stuck. Sometimes this will cause pain walking up and down stairs, kneeling, squatting, getting up from a sitting position. And it's typically located to the side of the spine. So those are some of the common things that we see. The joint is made up of these two bones, ilium and the sacrum, and it's designed to glide. Pain is typically off to the side of the lower back, worse when walking up and down stairs, worse with sleep, and oftentimes with bending, stooping, kneeling, squatting. Now the pain pattern can be extremely vague, and it's oftentimes associated with sciatica. So its pain pattern can be pain located in that glute area. It commonly refers pain down the leg because the sciatic nerve goes right by this joint. So it commonly refers down the leg. It can cause pain radiating into the groin. This is a common complaint. These abnormal pain patterns in the groin, pain can be referred into the glutes, so these muscles in the backside. And it can help radiate pain all the way even down to your foot. So the SI joint, and what SI joint dysfunction is as we look at it, the SI joint can be just inflamed. So that's called sacroiliitis. So the joint itself can just become inflamed, and that can be the source of our problem. It can be fixated, where the joint is stuck. And usually those are the most common two things that we see with the SI joint. It can also develop some arthritis, which we don't see terribly commonly. It's there, it's pretty rare. But the most common things that we see is just SI joint inflammation called sacroiliitis and SI joint fixation. So the other thing that causes a lot of SI joint pain is if the pelvis is unlevel. So pelvic unleveling is unbelievably common. I spent years in surgical practice, 10, 12 years working with surgeons, whether it was spine surgery, shoulder surgery, knee surgery, etc. And oftentimes, we don't really look much at the pelvic alignment unless we're doing hip replacements. That being said, if the pelvis is out of balance, what that does is it puts a tremendous amount of stress on some of the bones and joints on the side that are now on the lowest side of the pelvis because they're taking more stress. And that is a huge, huge, tremendous source of what is causing some of the SI joint dysfunction. Now, we also see a lot of SI joint dysfunction in patients who are post-operative, like we talked about last week. And the reason being is patients who are fused. As we fuse, there's a lot of scarring to some of the muscles in here. And some of the persistent pain after surgery can be because these muscles have now scarred, and these muscles are designed to be loose so the joint can move, but they fixate and pull the joint. So this is a very common problem post-operative as well. So treatment options. To review before we get into treatment options, the SI joint is made of two bones. Again, the sacrum and the ilium. So these two bones come together, make this joint. The two most common things that we can see with this joint when it becomes an issue is sacroiliitis, inflammation of this joint, or fixation, which is one of the most common things. Again, it can also develop arthritis, but it's far less common. Review of symptoms. Symptoms are also oftentimes located in the hip. A lot of patients, again, point to the backside of their lower back, the hip, often on one side, typically only. It can radiate pain into the glutes, down the legs to the toes, into the groin, or even into the thigh. A lot of the muscles that often attach through the glutes here as well become extremely sore and painful. So a big source of problems with the lower back. Now, if you look at that little type on our Facebook feed, you'll see that studies have shown that 15 to 30% of back pain is in relation to the SI joint. So those of you who may be out there, perhaps you're seeing a chiropractor, you're seeing a physical therapist, or even maybe seeing a surgeon or had epidurals, etc., and you're still struggling with this pain that just doesn't seem to go away, perhaps gets temporary relief. Oftentimes, this is a sign maybe we're dealing with the SI joint. Now, treatment for it. What can we do for it? Many treatments can be very effective without surgery. Surgery can also be done too, but it can also be very successfully treated at least 90% of the time without surgery. Simple things to the most aggressive things. Simple things to do. A chiropractor trained well in SI joint dysfunction can be very helpful. There's one drawback though, and we see this very commonly in the community, is that if we're just adjusting through the SI joint, but we aren't aggressive enough at loosening up some of the muscles through the SI joint, what we see is it just doesn't move well because we never get the muscles to loosen. I like to use this analogy of the Tin Man. When they walk up to the Tin Man and he's frozen and he's stuck out in the rain, they don't just move him. Oil can first, movement second. So typically we like to do some type of muscle work along with the chiropractic work to allow that joint to move much better. So if you feel like you're seeing a chiropractor or perhaps a physical therapist and it's stuck, perhaps you don't have enough muscle work with it. Now, chiropractics is a good first line treatment for these. And again, if it's not working, it needs more muscle work typically. And we see that as a success all the time from patients who have failed chiropractics in isolation who come to our office. Now, the second thing that can be done is there's some specific types of physical therapy that can be very beneficial for these. Here's the common pitfall that we see though. I'm gonna get my computer back up here. Common pitfall that we see is that a lot of times physical therapy is focused on strengthening the core. So if we're strengthening this joint that is inflamed and or the pelvis is unlevel, or if it's fixated, all we typically do is make something that's stiff and sore, more stiff and sore. So oftentimes we don't approach these issues with physical therapy. with core strength, but we like to use a style of physical therapy called McKenzie. And there are, if you do some research, McKenzie stretches online, which you may find success with, but typically McKenzie done properly is going to require a mechanical diagnosis and then apply the therapy. So what's called MDT, mechanical diagnosis therapy for McKenzie, a terrific way at restoring pain-free motion back to the SI joint. And oftentimes, again, we're working pretty aggressively with some type of muscle work through here to assist. Those are two fantastic treatments. Now, the third thing that we oftentimes will do here, if we need to, is two types of very simple injections that can be done around the SI joint to assist with reducing the inflammation, but also assisting with restoring motion. And this is where we get fairly assertive with some of the muscles. We have several fantastic massage therapists here on site. We do a style of massage called active release therapy in and around the soft tissues of this joint, where we're stretching and kind of working through these muscles. And then we try the alternative therapies like chiropractics or McKenzie to get the joint moving. Sometimes we need a little bit more than that, and some people that have been dealing with this for years, and that's where our injectables come into play. We are able to take needles and drive right into either the SI joint itself and or the soft tissues and muscles. And we can do several different things with needles. We can just dry needle into the muscles, which will kind of loosen those up, kind of like tenderizing chicken or beef for a grill. We can inject a corticosteroid or a type of cortisone into the joint and call that the oil can for the Tin Man. A tremendous combination and synergy with some type of corticosteroid injection and or chiropractic adjustment and or McKenzie therapy simultaneously. Terrific. So it's a terrific combination. We also do what are called trigger point injections, where we can inject into some of the muscles surrounding this area along with some of those other modalities to help loosen the muscles and allow better motion of the joint. So those are some of the common things that can be done, along with, at times, for people that are doing some repetitive lifting, heavy work, yard work, etc. There are things called SI belts. And an SI belt is oftentimes something that you can buy online. There's also some that are prescriptive, and there's some that can be custom fit. So these can be another huge tool to reduce flare-ups of the SI joint once you settle this down. It is a specific type of belt that helps stabilize the SI joint, so once it is stabilized with conservative care, that it doesn't destabilize once again, depending on what's causing the issue. And of course, the first thing to do there to find out what's causing the issue is just a good exam and some good imaging so we can find out what type of imbalances we have that are contributing to the problem. Now, last but not least, what can be done with the SI joints, and this is done on rare occasions, but we do have the ability of getting into the hands of folks to do this if needed. There is what's called an SI joint fusion, where surgeons can surgically fuse the SI joint. It's extremely rare, but it is done for those that are refractory to conservative care, as we had mentioned, either with formal ART massage, trigger point injections, SI joint injections, chiropractic care, McKenzie therapy, etc. If amendable, and if a surgeon feels it's beneficial, sometimes they can place some screws through this joint to fuse it. Now, again, that's a pretty rare treatment for that to occur because they typically respond so favorably to conservative care. Now, that's a lot about SI joint dysfunction. So, kind of wrap it up. If you notice that you've got pain persistently off to the side, left side, right side of the lower back, despite conservative treatment in isolation, perhaps therapy, chiropractics, non-steroidal anti-inflammatories, ice, heat, activity modification. You're doing all of these things and you're still finding that the joint is still an issue and you just can't sort this thing out. Of course, we'd be happy to see you. Our first step is always, and as always, get a good history, listen to what you're telling us, get a detailed and thorough exam, review images in detail, put that together so we can establish first our diagnosis. Is this your issue? And if you've been dealing with pain, again, that's refractory, that's okay. Sometimes we work with things in an integrated fashion, and that can be unbelievably successful. So feel free to reach out to us. The phone number should be listed on this feed, 330-242-7669. You can also hop onto our website again, ohiopain.com, and we typically post this on every social media platform that we have, whether it's Google My Business, on YouTube, Twitter, Facebook, and Instagram. So you should see this posted, and if you have questions, feel free to comment. Myself, Julia are always standing by to answer questions that you may have. And if you find that you're dealing with a persistent issue that's just beginning to interfere with quality of life and or sleep or activities of daily living, feel free to reach out to us. We'd be happy to help. We are in network with all major carriers. So of course, we'd be happy to help in any way possible. And the one thing we always promise folks is if we can't get the solution here, the good thing is we have great relationships with all of these fantastic hospitals and surgeons here locally in Northeast Ohio, and we have the best of the best, and we can get you over to the best of the best, and we can certainly do that as well. Thanks. Tune in next week. We'll be putting out more great information, and enjoy some of the sun this weekend as we finally start to warm up here in Ohio, and we'll see you next week.